This is a phase 1b study that we've put together based on preclinical data that shows the combination of an LSD1 inhibitor, in this case Iadademstat, from Horizon. It shows a lot of preclinical synergy with Venetoclax. There are other studies of LSD1 inhibitors, specifically with Iadademstat as monotherapy in relapse refractory AML, where it showed some activity. And then in the phase 2 ALICE study that was actually previously published in combination, IATA in combination with azacitidine, where a fairly respectable composite CR rate in the 50 to 60% range was observed, which was not quite as high as what we would expect with azacitidine and Venetoclax, with a composite CR/CRi rate of around 66.7%. So this trial is addressing the question of, we see activity of Iadademstat with AZA, we see activity as monotherapy, but can the triplet therapy actually further improve outcomes? And so this is a phase 1b study investigating the combination of Iadademstat with azacitidine and Venetoclax in patients with newly diagnosed AML that are adverse or intermediate risk using the ELN 2022 risk stratification criteria. So far, we have enrolled 10 patients on study. We've actually enrolled 12 to date. There are 10 patients in the presentation, and we've seen very nice response rates. We've seen a 100% overall response rate. We have a true CR rate of 90%, which is very encouraging when we think that these are true CRs. This is not a composite CR rate. And fortunately, we've seen a very tolerable safety profile. We haven't had any. We have had one dose-limiting toxicity, which was an infectious event in a patient who was still going through their first cycle of therapy. But other than that, one event, we haven't had any other dose-limiting toxicities, and we continue to accrue up to 21 patients at the higher Iadademstat dosing. So we explored 100 micrograms of Iadademstat in dose level 1 compared to 150 in dose level 2, and that's the cohort where we continue to accrue patients on, and follow-up is ongoing. It's a little too early to discuss the survival outcomes of this patient population. The median follow-up is still less than a year. So I think that data is eagerly anticipated as we continue to enroll patients on the study.